listeners, welcome to Views on Health. On the program tonight is Dr. Mihira Manamperi, consultant pediatrician, Sri Jayawardhanapura General Hospital in Kotte. We had Dr. Mihira Manamperi last time around on the program speaking on fever in a child. The topic under discussion tonight is bronchiolitis, a problem that children do face, and I'm no expert to touch on it in any way. Over to you, doctor, to introduce the topic.
Yeah, first of all, thank you very much, Fatima, for having me here today. Bronchiolitis, I would say it's a bronchiolitis. It's a technical jargon. So it's the same cough and cold you and me get. When it happens to a group of kids who are less than 1 year, we call it as a new term, like the technical term called bronchiolitis. So it's the same thing. They develop, respiratory symptoms. So most of the time, this bronchiolitis is caused by the viruses. And during the pandemic, COVID-19 did a big role for bronchiolitis. And as well as when we had this influenza epidemic again, influenza virus did it, and there are so many other viruses like respiratory syncytial, as well as rhinovirus, enterovirus, human metapneumovirus, or so many. So it's a viral illness, and when it happens to less than 1 year group, that's the demarcation. So we call it as bronchiolitis because it has a different, completely different compared to a above 1 year kid. So these babies have a different, what you call, sequelae of the infection.
Is it possible to tell us, because it will again differ from baby to baby, but from about which point in time after the baby is born that a baby can contract some sort of an infection that will bring on these symptoms?
It can happen even like, soon after the birth. Sometimes, there are, if you go for I'm referring to the mothers, if you go to a government hospital or if the hospital is crowded and all, and even at private sector, say that your healthcare workers are having similar symptoms, and if your spouse is having similar symptoms, say your husband or your grandparents, so soon after the delivery, there is a lot of excitement going on among the families in Sri Lankan tradition. So many people visit the baby. So anybody, the virus can transmit from any of them to even to a newborn, like just day 4, day 5 newborns could present with bronchiolitis.
In that situation, doctor, what does one do? It can be so frightening from a lay perspective.
True. It is frightening, and they don't expect your newborn to become sick, but you may appreciate the child may starts with some little bit of sneezing, little bit of obstructed nose and noisy breathing, and you can see a little bit of runny nose. So those features with fever could be the earliest signs of bronchiolitis in less than 3 months babies, the smaller ones.
So in the sense, doctor, is there a way of treating a child who's under 3 months or a child who's over 3 months? What would doctors do?
The treatment, of course, it depends on the age group. So I would say less than 3 months, they have very subtle symptoms. So all what I mentioned before, like sneezing, a little bit of runny nose, obstructed nose, is the very earliest symptoms you would get. But the thing is, this bronchiolitis could evolve over a period of days, unlike in a bigger child. So if you take, say, for instance, a 1-year-old, you get this cough and fever, coryza symptoms, you get the medicine. So following day, you may appreciate a drastic improvement. But these younger babies, they don't do that way. So if you have a little bit of runny nose, little bit of fever, so you may go to your general practitioner, your family physician, so he might prescribe some nasal drops and some antihistamines. So you may continue it, but you realize by day 2, day 3 of the illness, fever is continuing, as well as these symptoms, runny nose, nasal obstruction, is getting worse and worse. Sometimes by day 2, day 3, baby would start coughing as well. So what my personal experience is, mothers are getting really anxious, so they visit a doctor on the morning, and again, if the symptoms are not getting any better, they visit another in the evening, and likewise they are switching doctors one after the other during a matter of 3 days. So sometimes they do have 3 sets of medicine. So it is the natural process. So during this interview, what I want to highlight is that, so it's a natural process. Despite giving these medicines, bronchiolitis is a illness that can progress. So your treatment may not going to really help, and it will go into like a peak. The peak of symptoms usually happens on day 4, day 5, day 6, and then again there will be a week, maybe about 5-7 days to symptoms to settle.
In this situation, doctor, if it's a baby, obviously it's always a question that parents come up with, because a baby can't talk.
Absolutely.
And can't express what he or she is going through, which is the most difficult part. I was call it a sad part from my point of view. An older child can say something.
Very true.
This is what I have, mom, dad, whatever, express even to the doctor, but a baby can't. So how do you detect? You have to use your medical expertise to detect what the child is going through, because the child can't say, this is what I'm going through.
Yes, absolutely. Compared to previous program I said about fever last week before, what I have to say is, now if your baby is say less than 3 months, it's very difficult to assess by your own. So very few things alarming, or what we call it as a red flag signs. So red flag signs would be when the baby is having a lot of phlegm. They don't like to drink milk, as well as they will lose interest in looking around. So the child will be really floppy, child will be lethargic, as well as when you really concentrate on the number of wet nappies or the passage of urine compared to when the child was healthy, it could be almost like, say, 50%. So in my advice is, if your baby is less than 3 months, and say, I'm sure the baby must be having elder siblings who brought the virus, they could be also sick, but for your 3-month-old you need to pay medical attention earlier. As what Fatima suggested, it is very difficult. They can't talk, they can't show their gestures, so only clues you can catch from the babies, that if the baby is throwing up whatever the milk baby had, and baby is not keen on any more breastfeeding, and if the baby is not passing enough urine, so better to check from a qualified doctor. So the medical point of view, we do check various other parameters. So the moment we see the baby, we would like to we use our technical knowledge or the technical skills to assess the child's hydration, whether the child is has enough fluid in the body, as well as we assess the pulse rate and assess the temperature. The more importantly, we always look at the chest. So you can just remove the top and see whether there are indrawing underneath the ribs, or whether the skin just above base of the neck, just base of the neck skin, whether the skin is indrawing or the skin is sucked in. So all are we call it as, in technical term, work of breathing. So if the child is working hard to breathe, so that means child has significant chest involvement. So virus has already entered the chest and it is progressing. So what will happen when the child is if the virus is settled in the chest, the child is having if a child has to work hard to take a breath, so they easily get tired. And at the age of less than 3 months, very earlier signs are they lose interest on breastfeeding, as well as they don't look well, and they won't playful or anything. So at the early part of the illness, better you get checked from a doctor and make sure that he has gone through these parameters and reassure you. Having this runny nose, obstructed nose, or noisy breathing, little bit of cough and sneezing, they are not really alarming. The alarming signs are, I always say, how the child is feeding and how the child is breathing. So those are the two main parameters as a pediatrician what matters to us. So if the child's feeding is okay, then the hydration, signs of hydration should be all right. If the child's breathing is all right, then you won't see this what you call these chest indrawings. If they are not there, we generally teach you all how to do the feeding as well as how to control the temperature, little bit of symptomatic treatment, and allow you to go with a plan of early review. So if the child is not getting any better during following day or day after, you may have to go for a repeat consultation.
Thank you, doctor. The child now obviously has to be monitored by the mother or the caregiver in the house.
True.
It's important. Would this condition be such that, will it aggravate where you might have to hospitalize the child?
Yes, at some point, this is something, it could evolve. So again, we can't really say, looking at day one of the baby, say, for example, I will take a 2-month-old baby with bronchiolitis. On day one, child may appear well, apart from little bit of runny nose and noisy breathing. But by day 2, child may start showing those signs which I just mentioned, what you call increased work of breathing. So if the mother is going to work or the father is not there, so always better, in Sri Lankan culture, most of the time grandmothers are looking after the baby, so better you educate them. If the child is not keen on drinking, and if the child is not passing urine, and always even nowadays we all have smartphones, even the grandma has smartphones. So what she has to do, lift the shirt and take a kind of a small video clip and WhatsApp across to the parents, and they can identify whether the child's respiratory rate has gone up, and whether the child is showing some what I just mentioned, indrawing of the skin in between ribs, as well as the skin, just base of the neck skin sucked in. So the all are signs of child is trying to accelerate his respiratory rate. So that's the time they should, irrespective of availability of the parents, they should go for a review as soon as possible.
Very interesting, doctor. You spoke of a smartphone. In this situation, it comes in useful. So would you, as a consultant, when parents come with the baby, show them this is what you can do with your phone, because that's how they can pass it on to maybe a grandparent or another caregiver taking care of the child. If the parents are not at home, they have to work, but they unfortunately can't be with the child. So it will be very interesting that they can use the phone to see what the baby is going through, and then pass that on, which can lead to prompt attention if need be.
Absolutely. Now, most this younger generation specialists as well as the modern doctors always use that. And when we had this economic crisis back in, the fuel crisis back in May and June, so in Javadhanapur Hospital Pediatric Department introduced a smartphone concept where those who were under us, we offered our hotline number. So whenever they had an issue, so we guided them. So some of the mothers' complaints was like, my baby is just 3 months, now having fever, having runny nose, cough, coryza symptoms. So they are from, say, sometimes Javadhanapur Hospital is an amazing place where you drained from vast areas. So they are way up to Ahaliyaguda, Ratnapura, some are from Matugama, so they can't really come, they don't have enough fuel. So what we suggested them, so why don't you lift the shirt and take a clip like this, and maybe about 30 seconds, and send across to us. If the child is breathing fine, we can just follow up for the next day. If the child is breathing fast, we told them, look, what we can see here is not good. You are going to have a rough night. I think better, I can't really do anything else, but somehow or the other you need to bring the hospital either to Javadhanapura or to the closest hospital you could go at this point of time. So these smartphones and these video clips and sending across them made, I mean, most of the times lives easy. Even our personal practice, we do that. The grandparent take the video clip, send across to the parent, so parent, I mean, the father or mother can liaise with us, so we can, I mean, help them. What you call it, it's all about telemedicine now. Things has evolved, so we I mean, we help them to ease their life.
That's really good news, Doctor. I'm so happy, and I think I should, on behalf of the Sri Lanka Broadcasting Corporation, congratulate your team
Thank you very
of
much.
doctors at the Sri Jayawardhanapura General Hospital, because you're on call. That's what it means. And even if you're off duty, you might have a parent. You have forwarded the hotline to them, and in a time of need, it may not be an emergency actually, but for them it would have been something serious and worrying, and they can have the comfortable feeling that they can reach the doctor, and at least you will then at least assure them, look, this you don't have to worry, but this you need to worry.
Exactly.
Either way.
I mean, exactly. We got the same feedback. I mean, for parents, the main worrying symptoms would be having relentless cough or sneezing at a stretch for 30 seconds, or maybe having a fever spike. But from the clinician point of view, we would like to see the hydration level of the child, how the child's appear. I mean, if the child is having cough and all, but he's still playing around, so we don't really bother. And then what we want to see, the chest. The chest is quiet and it doesn't have any indromins, we are happy. So most time, I mean, with these facilities, we managed to, I mean, help them a lot. So they were so anxious. So for them, the cough is the main issue. For us, it's a different thing. So we I mean, reassure them, say, look, there's nothing much, just forget about this cough. I mean, you just have to give these medicines. Cough will settle within the next couple of days, but what matters is these parameters. Now with your video, I mean, we're quite happy about the outcome. I mean, we can happily say, because we are expert on this matter, so we can happily say your child is not going to I mean, get worse within next 24 hours. So it's a immense, I mean, relief for them during that time particularly.
Is that service still available?
We are continuing
so many
it.
months away, and we don't have the fuel crisis.
Yes. So we do still continue. And the other thing is these other ones, like, I mean, diverting bit off the topics, the dengue patients. So, I mean, even upon discharge, their platelets are not normal. So they're supposed to, in a normal routine day, they were supposed to come to the clinic, probably daily basis, till the platelet counts are normal. So we again introduced this system through across WhatsApp. So all they had to do is go to whatever the nearest laboratory. It could be at Nagoda, Kalutara, Aliugoda, wherever. So you get the printout and take a picture of it and send across to our WhatsApp number. So we send a message, your platelet counts are fine, shall we stop this? So we practice a lot. I mean, imagine usually with these babies, they can't travel on buses. That's what I witness. So they always hire a vehicle, either three-wheeler or a cab, whatever. So they don't usually travel on the bus. So it's I mean, it's at a huge cost nowadays with these world prices and all. So I think this is the time we have to think more differently, trying to introduce these sort of medications, I mean, systems, to facilitate to live with this life, right?
So actually living up to the Hippocratic Oath.
Thank you.
Thank you, Doctor. It's really tremendous, and I'm amazed that Sri Jayawardhanapura General Hospital is doing this yeoman service, providing this yeoman service to its patients. It's really wonderful, and it's really heartwarming to know that parents have the facility to reach out to their doctor if need be, especially with children, because like I said a while ago, and you agreed, a baby cannot express
Absolutely.
himself or herself. So that's the difficulty there. Thank you, Doctor. I'm really, really touched by what you have told me, and I hope our listeners feel the same. Having said that, now we move on. Now, this bronchiolitis is a common problem, and it can be treated, and the child can overcome the infection.
Yeah.
Can it recur?
Yes, it can recur. The biggest problem is like this bronchiolitis caused by the viruses. So we have multiple viruses. I think everybody would know about influenza, COVID, and maybe, yes, para-influenza, 1 or 3 viruses, but there are so many others. So what happened is, I mean, most of the time when you have a younger sibling, say less than 1 year, they do have an elder sibling who goes to the kindergarten or Montessori or whatever preschool. So the preschoolers are the culprits actually. They virtually, I mean, there's hardly any hygienic practices among them. I have to say that it's very difficult to ask them to place a mask throughout. And when they sneeze and then they cough, unless they use their elbow or a handkerchief, so these droplets spreads everywhere. So they do, I mean, share their own, they do touch the neighboring child, as well as they do share their toys. So with that, we have hundreds of viruses, so they are just simply sharing. So one thing I can I use this moment to educate our parents. If your child is sick, my humble advice is you shouldn't send the child to the preschool. I know that most of the mothers are complaining to me and say some of the kids are having high fever, cough, coryzal symptoms. With everything, they brought they brought their kids to the daycare center or the preschool. So that's the way how these viruses get transmitted each other. So in order to stop that, you can do that part. Answer to your question: yes, bronchiolitis can recur multiple times from different viruses with different severities.
Would that in any way be dangerous for the child, the recurrence? Impact on his or her health?
I won't say like it can create having recurrent infections may not have a long-term sequelae. They won't end up having bronchial asthma. Those researchers haven't showed having multiple episodes of bronchiolitis at the age of 1 year would lead to chronic lung diseases or so on, long-term lung problems. But the thing is, each episodes, the severity could be differ. As I said, you have to keep it in mind. So if the child is having just simple cough, coryzal symptoms, nose blockage and all, that's fine. But if you have increased work of breathing, so sometimes we have to hospitalize them. We have to give some respiratory support. We have to give oxygen. We have what you call high flow oxygen machines. So sometimes, despite giving all some babies, we have to escalate the care up to pediatric intensive care treatment. So my concern is, if the baby is younger, if your infection is severe, and if you show signs of this increased work of breathing, we have to support the baby with with ICU care. So for your first 2-3 encounters could be mild, but the fourth one could be a severe one. So each episode till the child recover, I think being parents, your responsibility is to look after the baby closely. And as I said very early, this illness can go up to a couple of weeks. It will not settle within 3 to 4 days, unlike in the bigger kids, like in other kids,
because they are smaller and they are more susceptible to catching the infection.
Absolutely.
Thank you, Doctor. Well, it's been so interesting listening to you, and like I said, once again, the way you shared the information about how your hospital is accessible, meaning you, the medical personnel are accessible to parents who are having a sick child and having these issues of bronchiolitis or fevers, is really, really tremendous. And I wish that this is being replicated in the other hospitals. I really don't know, but this is wonderful. Doctor, time has caught up with us once again. When good things happen, time seems to fly. So I'll have to ask you for your take-home message.
Take-home message is, leave aside bronchiolitis. I would say, now many people are thinking of migrating to Australia or England. So I worked both setups, both in England as well as Australia. So here we have a tremendous healthcare service facility. Here you can easily, when your child is having bronchiolitis or whatever illness, you can have according to your financial status, you can access to a general practitioner, to a pediatrician, or to a general hospital, or maybe a private hospital with much ease. When you go to the Western setup, they hardly, they're very difficult to access to a consultant pediatrician. Here, I'm just a pediatrician, but there are so many others around Colombo as well. They're doing a tremendous job. So my take-home message when it comes to bronchiolitis, what you can do is, if your child is less than 3 months, so you have to have a decent general practitioner or a pediatrician follow up under him. He needs to his advice, his or her advice, because it is something can drag up to 2 weeks. As a parent, don't get anxious and don't switch from one doctor to the other. And it's not going to help. I mean, it can make even worse outcomes. I mean, say you go to a particular doctor with you receive some medications, and you when you visit the second doctor, so he has to change whole the prescription. What's the point? I mean, you all are not going to be happy with the same medications he prescribed. So he has to going to do a new whole set of medications which are going to have more adverse effect on your baby. So just be patient and wait for it. I mean, it will take good 10 days, but your child will eventually recover. And two things we bother is how the child is feeding and how the child is breathing, not the cough, not the coryzal symptoms, not the blockage nose. Okay.
Thank you, Doctor. With that, we end this interesting discussion on bronchiolitis and place on record our grateful thanks to Dr. Mihira Manamperi, consultant pediatrician, Sri Jayawardhanapura General Hospital in Kotte, for once again sparing your valuable time to be with us on the program in the midst of your busy schedule and sharing your expert knowledge in your field of specialty. Thank you so much, Doctor.
Thank you very much, Fatima, for having me here and inviting me to this program.
Our pleasure always, Doctor. Thank you. Thank you also to Nadika Jayasekara for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday same time on Views on Health.